Look closely at this waveform. The breaths are wider, the plateaus are taller, and each wave contains more CO2 than the last. The peaks keep rising and exhalation takes longer. This pattern represents hypercapnia from hypoventilation. Physiologically, the patient isn't breathing enough to eliminate the CO2 being produced. CO2 accumulates in the lungs and bloodstream, leading to respiratory acidosis. Common causes include opioid overdose, sedatives, airway obstruction, fatigue, neuromuscular weakness, or late-stage respiratory failure. Immediate actions include opening the airway, increasing ventilation, assisting respirations with a BVM, and reversing the cause if possible, such as naloxone for opioid-induced hypoventilation. Thanks for watching. If you found this helpful, go ahead and like the video and subscribe to the channel so you don't miss the next one. And if you want the full masterclass, along with tons of other high-yield medical education, visit academy.emergeprep.org. And I'll see you in the next lesson.